are discuss about the renal function test. First of all, introduction. What is the purpose of the renal function test? Renal function tests are used to assess the function of renal. It is also used to assess the progression of disease related to whether kidney is functioning properly or not, and if person are suffer from the renal disease, then progression of renal disease, treatment, it is effective or not, it can be assessed by using the various renal function tests. What is the normal function of the kidney? First, it is a excretion of the waste product. It is a major function of the kidney is excretion of the waste product like urea, uric acid, creatinine and other waste metabolites. Second, maintenance of the acid-base balance. Kidney have a major role in the maintenance of the acid-base balance. Third, maintenance of the water and electrolyte. It is major role of kidney to maintain the sodium, potassium, calcium, bicarb, chloride level in the blood by reabsorbing and secreting the analyte. And fourth, it is a hormone synthesis like active form of the vitamin D. It is also known as the calcitriol, 1,25-dihydroxycholecalciferol. Okay. So last step of the vitamin D activation, it is occur in the kidney. Second hormone like erythropoietin, it is also secreted by the kidney. So kidney, it is also used for the various hormone synthesis. It is also helping activation of the angiotensin by releasing the renal enzyme. So there is variety of the function of the kidney, but major functions are concerned with the acid-base balance, water electrolyte and excretion of the waste product. That is a basic unit of the renal. It is made up of the, it is nephron. Okay, it is made up of glomeruli, proximal convoluted tubule, loop of Henle, distal convoluted tubule and collecting duct. The purpose of the kidney, it is a formation of the urine. Around 180 liters of the fluid, it is a filter per day by normal glomerular filtration. Among them, majority of the fluid and electrolyte are and filter products are the reabsorbed. Among them mainly amino acid, glucose and various electrolytes are the reabsorbed, and some of them it may be secreted by renal tubular cell into the lumen. So by the end of the three process, glomerular filtration, reabsorption and secretion, the final urine are the formed in collecting duct and it is excreted as a urine, and volume of the urine per day, it is around 1.2 to 1.5 liter per day. So 180 liters per day filtrate, but only 1.5 liter of the urine are the excreted from the body. So remember, majority of the fluid, around 99.9%, it is a reabsorbed by tubular cell. So renal function tests are generally classified as to assess the glomerular filtration function, to assess the glomerular permeability, means integrity of the glomerular structure, and third, to assess the tubular function. For the assessing the glomerular filtration, major test, it is a clearance test. Various substances are the used for the assessing the clearance test, include creatinine, urea and inulin. For measuring the integrity of the glomerular structure. Most common test, it is assessing the protein in the urine. Normally protein are absent in the urine. If it is present, it is the first indicator of the urine glomerular first indicator of the kidney damage, means glomerular structure are the damage. And for the assessing the tubular function, mainly two tests, dilution test and concentration test are used to measure the specific gravity of the urine. We can learn each and everything in the detail. Clearance test. What is the meaning of clearance? Clearance, it is a amount of the blood completely clear of particular substance in unit time. Suppose we are using the creatinine. So amount of the blood completely clear of creatinine substance per minute. It is known as a creatinine clearance. Amount of the blood completely clear of the urea in the minute. It is known as the urea clearance test. Okay. And same things also happen for the inulin clearance. So overall mainly three substance for the measurement of the clearance. What is the similarity and dissimilarity substance used for the clearance test are include inulin, that is it is not an inert substance. We can use the inulin as a substance, exogenous substance. It can be given as a intravenous fluid in the blood, and after some time that level it is measured in the blood and the urine for assessing the clearance test. Unlike in case of the creatinine and the urea, both are the inert in the nature, means they are the synthesized by our body and it is circulating in the blood and freely filtered by the glomeruli. All three are the freely filtered by the glomeruli. Among them, inulin and creatinine, it is not a reabsorbed by renal tubular cell, but urea, it is around 40% of the urea, it is reabsorbed. So it gives the false low GFR estimates. Inulin, it is also not secreted by renal tubular cell, but creatinine, it is slightly secreted by renal tubular cell. GFR by inulin clearance test, it is around 125 ml per minute. In case of the creatinine clearance, it is around 90 to 100 ml per minute, and in case of the urea, it is around 70 to 75 ml per minute. It is clearance test, individual clearance test for the substance. Inulin, it is not affected by the protein diet. Creatinine, it is also not affected by the protein diet, but urea, remember, it is affected by the protein diet because it is an product of the protein catabolism. Creatinine, it is affected by the muscle mass because it is synthesized in the muscle from creatinine phosphate. Urea, it is mainly reabsorbed in a dehydrated condition, so it is affected by dehydration condition. So that is some advantage and disadvantage of the using the various clearance tests. Most commonly used the clearance, it is a creatinine clearance. General equation for the measurement of the clearance, it is UV by P. U means concentration of the substance in the urine, V means volume of the urine for 24 hours, and P means concentration of the substance in plasma or blood. There is a conversion to measure the substance in a 24-hour urine. First, collection of the 20. So it is a lengthier procedure. Every time it is not possible for the each and every patient, for the OPD patient. So to overcome the such barrier various equations are the used for measuring the GFR based on measurement of the serum creatinine level without use of the urine volume and urine creatinine level. That includes Cockcroft-Gault equation, MDID equation, that is a modification of diet in renal disease, CKD-EPI means chronic kidney disease epidemiologic collaboration equation are the commonly used GFR, that is known as the eGFR, estimated GFR based on serum creatinine and other variables. Variables include each and every equation are the different. Like in case of the Cockcroft-Gault, that is a variable, it is weight and sex. In case of the MDID variable, it is a sex as well as races. Here it is not included. Okay. For the American or Afro-American CKD-EPI, it is mainly based on the body surface area. So it is and sex. So different variables are the used for the different equations. So that equation are the mainly based on the measurement of the serum creatinine level. Based on the GFR, CKD are the classified into the. What is the meaning of CKD? CKD are defined as either kidney damage grossly. It can easily detected by imaging testing or other blood and urine report or by the GFR measurement. It is less than 60. Right? So that is the two possibilities. Gross appearance of the renal disease or renal damage, or it may be by estimating the GFR. So based on the GFR, that CKD, it can be classified stage 3 it is 30 to 60, stage 4 it is 15 to 30 ml per minute, and in the last stage end stage renal disease it is less than 15 ml per minute. So that is a classification of the. Is the first and most important test for assessing the renal function, mainly glomerular function. Second, for measuring the glomerular structure integrity, it is a proteinuria, measurement of the protein in the urine. Normally protein it is absent in the urine, but if renal glomeruli are the damaged, then protein can be filtered from the glomeruli and it is excreted in the urine. It is not necessary that the protein present in the urine it is only from the glomeruli. It can be present from the tubular cell. It can be present post-renal, means in the urinary tract, from the urethral cell. Okay? So that proteinuria, it may be glomerular proteinuria, it may be sometimes it may be overload proteinuria. And last one, it is a post-renal proteinuria. So most common protein present in the glomerular proteinuria in the urine, it is albumin. Tubular proteinuria are the seen in various metal poisoning, and especially in case of the overload proteinuria are the seen in various cancer like multiple myeloma, like Benson protein, hemoglobinuria, myoglobinuria, and last it is traumatic injury. So normally remember in the urine protein at the absent means it is easily undetectable by any method. Around it is less than 30 milligram per day. It is protein level, it is more than 30 milligram, is known as a microalbuminuria. Okay. Because most common protein are the excreted by kidney. When glomeruli are the damaged, it is albumin. That's why it is known as a microalbumin. More than 30 milligram per day. If that level it is more than 300 milligram per day, that is known as a proteinuria, or it may be gross proteinuria. In case of the nephrotic syndrome, that level it may be goes beyond the 3000 milligram per day, around 3 to 4 gram per day protein are the excreted by kidney. It can be measured by the routinely used dipstick method, BCG method, or some specific method for the microprotein and microalbumin estimation, like pyrogolar red method. Test based on the glomerular filtrate, it is around 180 liters per day, but urine it is only 1.5 liters per day. So majority of the urine and solute are. So if renal tubular cell are the damaged, and urine concentration and dilution ability of renal tract, it is a impact, and that can be easily measured by measuring the specific gravity of the urine. Normal specific gravity of the urine, it is 1.01 to 1.025. Mainly two types of the tests are the used, concentration test and the dilution test. In the case of the concentration test, overnight fluid deprivation are done in the patient. In the morning, 2 samples, 1 hour, in the 1 hour gap are the collected. Specific gravity of the urine, specific gravity of the urine are the measured in the 2 samples. At least in the 1 sample, specific gravity it is more than 1.25. It is suggestive of the normal function, normal concentration ability of tubular cell. Test, it is a avoid in a dehydrated patient, remember. Second test, it is a dilution test, in which fluid load it is given. Around 1.2 liter of the fluid it is given to patient. After that, 1 hour leave, 4 samples are taken. At least in the 1 sample from among the 4, urine specific gravity should be less than 1.01. It is suggestive of the normal dilution function of the renal tubular cell, normal secretion function of the renal tubular cell. Three major tests, serum parameter and urine parameter, are commonly used to assess the renal function and disease progression. Include serum urea, serum creatinine, studying sea level measurement. Serum urea. Urea, it is an end product of the protein catabolism. Post-renal condition. Pre-renal condition like dehydration, congestive cardiac failure, burns, septicemia, serum urea level are increased. Renal condition like glomerulonephritis, pyelonephritis, nephrotic syndrome, acute renal obstruction to the renal urinary tract due to tumor, stone. It may lead to the increase the serum urea level. So remember, the measurement of the urea, it is used to assess the renal condition. It can be assessed with the other, or it can be ruled out to diagnose the actual renal function. Second, it is a serum creatinine measurement. Serum creatinine. Creatinine, it is a synthesized from creatinine phosphate in the muscle by non-enzymatic conversion, that is a synthesized in the constant rate. Most common method for the assessment of the serum creatinine, it is just kinetics. Or second method, it is an enzymatic method. Normal value, it is around 0.6 to 1.2 milligram per deciliter. In case of the female, that muscle mass, it is low, so that value, it is slightly lower. Serum creatinine level, it reflects the renal disease but does not increase immediately when renal artery damage. Around 40 to 50% renal vein damage, after that serum creatinine level are increased. So that period, it is known as the window period for the serum creatinine, because around 30 to 40% when renal artery damage, still renal have an ability to maintain. After that, renal has lost its ability to maintain the serum creatinine level in the normal range, and after that serum creatinine level are the increase, and that is suggestive of the complete the increase in a muscle destruction, okay, muscular dystrophy or other type of the muscle damage, gross muscle damage. And third, it is a newer marker for the assessing the renal function. It is serum cystatin C level. It is the non-glycosylated cysteine protease inhibitor secreted by all nucleated cell, freely filtered but completely reabsorbed by renal tubular cell. After reabsorption, it is completely catabolized in a renal tubular cell, so it does not re-enter into the circulation. Remember, it is a completely filtered, completely reabsorbed, but after reabsorption in the tubular cell, it is completely catabolized. It never enter again into the renal circulation. Normal urine volume, it is around 1.5 liter per day. It may be decreased or it may be increased in various conditions. The color, it is normally amber color, yellow amber color. It may be sometimes changes depend on a different condition. Okay, so we should rule out the other condition. Order, normal it is the ammonite order. In certain metabolic disorder, that order should be checked. Specific gravity, concentration means drinking or dehydration. Various chemical tests, Nowadays, ready-made urine strip are available that include the most of these parameter. We just have to simply dip that strip into the urine and it gives the color according to substance. Thank you. Have a good day.